Before we dive in, hit the subscribe button for more expert insights and honest conversations on Raising Mama podcast.
Worldwide, it's about 14% of all pregnancies have gestational diabetes. And then in the United States, about 10% of all pregnancies have gestational diabetes. Yep.
And from my personal experience, I know women who have gestational, like my sister had it, and she's like a straight up beach body coach. Like she's very fit. And so I was just curious, why do some people get it and why do some people not get it? Do you know why that is?
I mean, it is so nuanced. As individuals, we're all so different and have different genetics and different family history. And then when we become pregnant, we have the placenta that sends off hormones, and our hormone levels are all different, woman to woman too. So it's really nuanced. You can't like just pinpoint and make a real broad stroke statement, I don't think. But I will tell you that the placental hormones are like the driving factor for it, because there are some women, like you said, like your sister, who is like super fit, probably knows a lot about her nutrition, focuses on those things and ends up with it. And then I have also met a lot of pregnant women who aren't that way. Not necessarily that's a bad thing, but they do indulge in their sugar cravings. They're not very active. They're not focused on their water, and they don't get it. So it's really hard to say like a blanket statement, but I mean, there are risk factors. Genetics are playing a role in mom's gestational diabetes, and the placental hormones are the main driver of the diagnosis.
What you're saying is it's not a woman's fault anyway. A big determinant of this is really just that your hormones change when you're going through pregnancy. And I was wondering if you could break it down a little bit more. What exactly are the hormones doing that are making it harder for us to, bring the sugars out of the bloodstream in a quick enough time, essentially? Why could we process the sugars before, and now what is the hormone doing that's making it so hard?
Yeah, the hormones are super important too. So I always tell people, if you have gestational diabetes, that means your placenta is working really well. So here's the plus side of that. Those hormones help your placenta function, and the placenta nourishes the baby. So that's what the hormones are doing. As far as how it keeps our blood sugars up, and kind of like an easy way, I think, to understand it is those hormones make us more insulin resistant, and insulin resistance is basically your insulin isn't working as efficiently, as quickly as it should. It's just like slowed down, a little sluggish, for lack of a better word. So blood sugars just stay in the bloodstream. Glucose stays in the bloodstream a little bit longer because insulin's slower due to those hormones.
But why is it bad to have sugar hanging out in your blood?
Because it can eventually cause some adverse outcomes with baby that we don't want to see. If mom's blood sugars stay too high, then the baby starts to produce more insulin in their body, because mom's insulin that she makes in her pancreas doesn't cross the placenta, doesn't go to the baby. So her insulin's working to try to lower her blood sugar. But if mom eats something and her blood sugar is really high afterward, then that glucose goes to the baby, that sugar is going to the baby. And if that happens, then the baby can start to produce more insulin. And the worry with that is then when the baby's born, and you cut the umbilical cord, so now they don't have mom's nutrition coming in anymore, but they have a lot of insulin that their body's produced. It would be like us injecting ourselves with an insulin when we don't need it. They're going to have a low blood sugar. So that's one thing. Wow. And then another, I would say that, and shoulder dystocia, where the baby puts on more fat, specifically around their shoulders. They see a higher incident that with gestational diabetic babies. They put on fat disproportionate like to a baby whose mom doesn't have gestational diabetes. So the worry with the shoulders being wider and a little broader is then a vaginal delivery, and baby could get stuck. So Those are the two common things. Other kind of rare things that could happen is baby can have some breathing issues, trouble regulating their temperature after delivery. And then, not to scare anybody, but if blood sugars are really, really uncontrolled and unmanaged, and usually we see this when someone's diabetic prior to pregnancy coming in, then there can be the risk of stillbirth. On the flip side of that, because I don't want to scare people by like, the stillbirth thing is really, really scary. I will tell you, in my 6 years, I maybe have known one person that has had that outcome over hundreds and hundreds and hundreds of women. I also like to say those are the risks, but I feel like we should be telling women in the same breath, you could absolutely have a healthy pregnancy and deliver a healthy baby with good blood sugar.